Top 7 vitamins every diabetics must take to manage blood sugar. 1. Vitamin D. If you're diabetic, you are bound to face vitamin D deficiency, and there are a few signs you need to watch out for. In vitamin D deficiency, you might feel tired all the time or notice muscle weakness, which makes daily tasks harder. Bone pain or a higher risk of fractures could also show up because your body isn't absorbing enough calcium without vitamin D. You could find yourself getting sick more often, since vitamin D plays a big role in your immune system. If you have nerve pain or tingling in your hands or feet, it could be worse because a lack of vitamin D can aggravate diabetic neuropathy. You might notice your blood sugar is harder to control, with more frequent spikes or drops. Mood changes or depression can also occur, as vitamin D affects your brain. On top of that, wounds might take longer to heal, and even hair thinning or loss could happen if the deficiency is severe. But why does this deficiency occur? Vitamin D deficiency is very common in people with diabetes, and it's not just a coincidence. Let me explain why this happens, because if you know the problem, you can accept my solutions. First, your kidneys play a big role in activating vitamin D in your body. But diabetes may be damaging your kidneys silently. This condition is called diabetic nephropathy, and this reduces the ability of the kidney to activate vitamin D. On top of that, if you're overweight or obese, your body stores vitamin D in fat, making less of it available in your bloodstream. Add to this factors like a poor diet, limited sunlight exposure, or chronic inflammation, which is already high in diabetes, and your vitamin D levels can really drop. Now, here's how this deficiency affects you. Vitamin D helps your body use insulin effectively, so when levels are low, insulin resistance gets worse, making it harder to control blood sugar. It also plays a role in helping your pancreas produce insulin, so without enough vitamin D, your blood sugar can rise even more. On top of that, vitamin D has anti-inflammatory effects, and its absence can allow inflammation to go unchecked, which can worsen diabetes complications. Speaking of complications, low vitamin D levels can make things worse in several areas. For example, it increases your risk of heart disease by contributing to stiff arteries and high blood pressure. It can worsen kidney damage, make nerve pain, neuropathy, more severe, and even increase your risk of blindness from diabetic retinopathy. Plus, it weakens your immune system, which makes infections harder to fight, something you already struggle with. If any of this sounds familiar, get your vitamin D levels checked. Fixing the deficiency can help you feel better, manage your diabetes, and avoid bigger problems in future. So, if you have a vitamin D deficiency, don't worry about it. It's something you can fix with a few simple steps. First, get more sunlight. Spend 15 to 30 minutes between 7 to 9 a.m. outside a few times a week. This time sunlight has the best wavelength, and in the exposed area of your skin it helps your body make vitamin D naturally. Next, focus on your diet. Add foods like fatty fish, salmon, mackerel, sardines, egg yolks, and fortified options like dairy, plant-based milk, or cereals. If you're vegetarian, fortified products and mushrooms exposed to UV light are great choices. Supplements can also help. Many diabetics need around 1,000 to 2,000 IU of vitamin D3 daily, but your doctor might recommend a higher dose if your levels are very low. Always check with your doctor to get the right dose for you. If you're overweight, losing some weight can release stored vitamin D from fat cells, making it more available to your body. Also, make sure you're eating magnesium-rich foods like nuts, seeds, and leafy greens, as magnesium helps activate vitamin D. Finally, stay on top of your levels with regular blood tests. This ensures you're in the optimal range and prevents complications. These steps are simple, but they can make a big difference in managing your blood sugar. 2. Vitamin B1 or thiamine. Deficiency symptoms. If you're diabetic and have a vitamin B1, thiamine, deficiency, you might notice several symptoms. First, you could feel tired or weak all the time because thiamine is essential for energy production. Nerve issues, like numbness, tingling, or pain in your hands and feet, could also worsen, especially if you already have diabetic neuropathy. You may also experience blurred vision or problems with your heart, such as an irregular heartbeat, shortness of breath, or swelling in your legs, which can be a sign of more severe issues like wet beriberi. Mental symptoms like confusion, memory problems, or irritability may occur too, and in severe cases, thiamine deficiency can cause Wernicke-Korsakoff syndrome. If you have trouble with wound healing, or if you're losing appetite or weight without trying, these can also be signs of thiamine deficiency. If you notice any of these symptoms, it's important to get your thiamine levels tested and address the deficiency to avoid further complications. In diabetes, vitamin B1, thiamine, deficiency is pretty common, and here's why. High blood sugar levels cause more frequent urination, which flushes thiamine out of the body. Also, diabetes can reduce the gut's ability to absorb thiamine properly. If you're not eating enough thiamine-rich foods, like whole grains, nuts, or seeds, that adds to the problem. Plus, the increased oxidative stress from diabetes uses up thiamine faster. Now, what does this deficiency do? First, thiamine helps break down glucose into energy. Without enough thiamine, your body struggles to use glucose properly, which can make your blood sugar harder to control. Thiamine also helps reduce insulin resistance, so if you're deficient, insulin doesn't work as well. This deficiency also has serious effects on diabetes complications. It can worsen diabetic neuropathy by increasing nerve damage and pain. Kidney damage, nephropathy, gets worse because thiamine helps protect the kidneys from harmful byproducts of high blood sugar. Thiamine is also key to your heart health. Without it, the risk of cardiovascular disease rises due to damage to blood vessels and poor heart function. Retinopathy, eye damage, can also progress faster. And wound healing is slower, which is a big concern in diabetics, especially for foot ulcers. So, thiamine is crucial for glucose metabolism, insulin sensitivity, and protecting against complications. How to overcome its deficiency? To overcome a vitamin B1 or thiamine deficiency as a diabetic, start by eating foods rich in thiamine, like whole grains, brown rice, oats, nuts and seeds, sunflower seeds, almonds, and legumes, beans, lentils. Fortified cereals and foods like pork, eggs, and spinach can also help boost your intake. If your thiamine levels are low, talk to your doctor about taking a thiamine supplement, typically between 10 to 100 milligrams per day, depending on your needs. Along with that, managing your blood sugar is key, since high blood sugar leads to more thiamine loss. Controlling your levels can help retain thiamine in your system. Eating foods rich in antioxidants, such as berries and leafy greens, can also protect your thiamine. Lastly, get regular blood tests to monitor your thiamine levels and ensure you're on the right track. Following these steps, with guidance from your doctor, can help you fix the deficiency and improve your diabetes management. 3. Vitamin B12. If you have a vitamin B12 deficiency, you might experience several symptoms. You could feel unusually tired or weak, making it hard to carry out everyday tasks. There may also be numbness or tingling in your hands and feet, which can make neuropathy worse. Mentally, you might struggle with memory, concentration, or feel mentally foggy. Some people experience an irregular heartbeat or feel short of breath because B12 is important for red blood cell production. Your skin may appear pale, and you could also notice slow wound healing, especially if you have cuts or injuries that take longer to recover. In severe cases, B12 deficiency can lead to confusion, dizziness, or difficulty with balance. If you're noticing any of these symptoms, it's important to get your B12 levels checked by your doctor to avoid complications. But why does all this happen in diabetes? You might face vitamin B12 deficiency for a few reasons. First, if you're on metformin, a common diabetes medication, it can interfere with how your body absorbs B12 over time. On top of that, if your diet isn't rich in B12 foods like meat, eggs, and dairy, or if diabetes is affecting your gut, it can be harder for you to absorb enough of this vitamin. A B12 deficiency can cause some real problems. It can make it harder to manage your blood sugar because B12 helps with insulin secretion and nerve function. If you already have neuropathy, nerve damage, a B12 deficiency can make it worse by causing more pain, tingling, and numbness in your hands and feet. Nerve damages might make you feel tired, weak, or struggle with mental fog. Also, this damage can cause memory problems and confusions. If left untreated, B12 deficiency can affect your heart health by increasing homocysteine levels, which is bad for your blood vessels. Plus, it can slow down wound healing, which is dangerous for diabetics who are prone to foot ulcers. If you're noticing any of these symptoms, it's important to get your B12 levels checked and talk to your doctor to correct the deficiency. If you're dealing with a B12 deficiency, here's what you can do. Start by including more B12-rich foods in your diet, like meat, fish, eggs, and dairy products like cheese and milk. If you're vegetarian or vegan, try fortified foods such as plant-based milks or cereals that have added B12. If that's not enough, Talk to your doctor about taking B12 supplements. They come in pill form, or sometimes even injections if the deficiency is serious. Since metformin can lower B12 absorption, it's extra important to keep an eye on your levels. Regular blood tests will help you and your doctor track it. Also, keeping your blood sugar levels stable is key. It helps improve nutrient absorption and overall health. It's always a good idea to check with your doctor, but these steps will help you get your B12 back on track. 4. Vitamin C. There are several signs that show you have a vitamin C deficiency. One of the most noticeable is slow wound healing. Cuts, sores, or ulcers, especially on your feet, might take much longer to heal. This happens because vitamin C is crucial for collagen production, which is needed for tissue repair. You may also find yourself getting sick more often or taking longer to recover from illnesses, as vitamin C plays a key role in keeping your immune system strong. Another common symptom is fatigue or feeling unusually tired, which can make managing your diabetes even harder. Your skin might become dry, rough, or scaly due to a lack of collagen, and you could notice your gums bleeding or feeling swollen more easily. Joint pain or stiffness can also occur because low vitamin C levels weaken connective tissues. Additionally, you might find yourself bruising easily, even with minor bumps, and could develop iron deficiency anemia, which leads to pale skin, dizziness, and shortness of breath. These symptoms can overlap with complications of diabetes, so it's easy to overlook them. If you notice any of these signs, it's important to talk to your doctor. They can check your vitamin C levels and guide you on how to address the deficiency. But why does vitamin C deficiency occur? If you're diabetic, you're more likely to have a vitamin C deficiency, and here's why. Vitamin C and glucose use the same pathway, called the GLUT1 receptor, to enter your cells. When your blood sugar is high, glucose takes priority, so less vitamin C gets into your cells. On top of that, diabetes causes more oxidative stress and inflammation, which quickly depletes your vitamin C levels. A lack of vitamin C can cause serious problems. It's a powerful antioxidant, and without enough of it, your body struggles to fight oxidative stress, which can make complications like neuropathy, retinopathy, and kidney damage worse. Vitamin C also helps improve insulin sensitivity, so if you're deficient, your blood sugar control may suffer. It's essential for wound healing, so a deficiency can slow recovery and increase your risk of infections, especially with foot ulcers. Plus, your immune system weakens without enough vitamin C, leaving you more vulnerable to illnesses. This deficiency makes diabetes complications worse. It's why you might face more nerve damage, eye issues, heart disease, or slow healing wounds. Addressing it with a vitamin C-rich diet or supplements can help protect your health. If you're diabetic and want to fix a vitamin C deficiency, here's what you need to do. Start by adding more vitamin C-rich foods to your diet. Choose options like oranges, berries, kiwi, grapefruit, bell peppers, and broccoli. These are healthy and won't spike your blood sugar. If you're not getting enough from food, ask your doctor about a vitamin C supplement. They might recommend a daily dose that suits your needs. It's also crucial to keep your blood sugar levels stable because high sugar levels block vitamin C from getting into your cells. Stick to your diabetes management plan, healthy eating, regular exercise, and medication if needed. Lastly, keep an eye on your health. If you're noticing symptoms like slow wound healing or feeling unusually tired, talk to your doctor. They can monitor your levels and guide you on the right steps to take. This way, you'll improve your vitamin C levels, strengthen your immune system, and help prevent complications. 5. Vitamin E. In vitamin E deficiency, there are several symptoms you should watch for. One of the main signs is muscle weakness, especially in your arms or legs, which makes movement more difficult. You might also notice vision problems, such as blurry vision or trouble seeing at night, as vitamin E is crucial for eye health. Nerve damage can also occur, leading to tingling, numbness, or pain in your hands or feet are common symptoms of neuropathy. Another common issue is feeling unusually tired or fatigued, as vitamin E helps produce energy and protect cells. A deficiency can also weaken your immune system, making you more prone to infections. Your skin might become dry or irritated because vitamin E helps protect and maintain healthy skin. Lastly, low vitamin E levels can contribute to heart problems, as the vitamin helps keep blood vessels healthy. If you notice any of these signs, it's important to talk to your doctor. They can check your vitamin E levels and help you find the right way to correct the deficiency. But why does this deficiency occur in diabetes? Here's why you experience the symptoms of vitamin E deficiency. Vitamin E is a powerful antioxidant that protects your cells from damage caused by free radicals, which are produced in excess when your blood sugar is high. Diabetes increases oxidative stress, and your body uses up vitamin E faster to try to control the damage. Over time, this can leave you deficient. Another factor is that some diabetics have issues with fat absorption, especially if they have digestive problems like gastroparesis, since vitamin E relies on fat to be absorbed. These issues can make it harder for your body to get enough. Chronic inflammation from diabetes also depletes vitamin E as your body tries to fight off the damage caused by high blood sugar. This deficiency can worsen your diabetes and its complications. Without enough vitamin E, oxidative stress increases, leading to more damage to your nerves, eyes, kidneys, and blood vessels. It can also worsen insulin resistance, making it harder to control your blood sugar. Low vitamin E levels are linked to a higher risk of heart disease and can speed up retinopathy, which can affect your vision. It even makes neuropathy worse by leaving your nerve cells more vulnerable to damage. In short, diabetes puts extra stress on your body's vitamin E stores, which can worsen complications. If you want to fix a vitamin E deficiency, here's what you need to do. First, add more vitamin E-rich foods to your diet. Good options include almonds, sunflower seeds, hazelnuts, spinach, broccoli, and healthy oils like sunflower oil or wheat germ oil. Since vitamin E is fat-soluble, eat these foods with healthy fats like avocado or olive oil to help your body absorb it better. If your diet isn't enough, talk to your doctor about vitamin E supplements. They'll guide you on the right dosage, usually around 15 milligrams per day, but this depends on your needs. Avoid high doses unless directed by a doctor, as too much vitamin E can have side effects. You'll also need to keep your blood sugar under control. High blood sugar increases oxidative stress and burns through your vitamin E stores faster. Follow your diabetes management plan with a healthy diet, regular exercise, and medications as prescribed. If you have trouble absorbing nutrients due to conditions like gastroparesis, speak with your doctor about how to improve absorption. Regular monitoring of your vitamin E levels will also help ensure you're on track. By taking these steps, you can rebuild your vitamin E levels, protect your body from damage, and lower your risk of diabetes-related complications. 6. Magnesium. To find out if you have a magnesium deficiency, you may experience a few noticeable symptoms. One of the most common is muscle cramps or general weakness, as magnesium is vital for muscle function. You might also feel fatigued or low on energy because magnesium plays a key role in energy production. Numbness or a pins and needles sensation, especially in the hands or feet, can occur due to nerve issues caused by magnesium deficiency. Another sign is irregular heartbeats or palpitations, as magnesium helps regulate your heart rhythm. Low magnesium can also contribute to high blood pressure, which is already a concern for many diabetics. Additionally, you may notice mood changes, such as anxiety, depression, or feeling unusually irritable. Lastly, difficulty sleeping or restlessness can also be a symptom. If you experience any of these signs, it's important to check with your doctor to assess your magnesium levels and address any deficiency. But how does this deficiency occur? Magnesium deficiency is common in diabetics for a few reasons. First, high blood sugar levels cause magnesium to be lost through urine. If you have insulin resistance, like in type 2 diabetes, it makes it harder for your body to use magnesium properly. On top of that, some diabetes medications, such as diuretics, can also cause your body to lose more magnesium. Over time, this leads to lower magnesium levels. When you're low on magnesium, it can make insulin resistance worse, meaning your body struggles even more to manage blood sugar levels. This increases the risk of heart issues like high blood pressure and irregular heart rhythms, which are already common in diabetics. A deficiency also affects your kidneys and can worsen diabetic nephropathy, which is kidney damage caused by diabetes. Additionally, low magnesium can worsen neuropathy, nerve damage, causing pain, tingling, or numbness, especially in your hands and feet. Magnesium is also crucial for bone health. A deficiency can lead to bone loss or even osteoporosis, raising the risk of fractures. To fix magnesium deficiency as a diabetic, the first step is to eat more magnesium-rich foods. These include leafy greens like spinach and kale, nuts like almonds and cashews, seeds like pumpkin and sunflower, whole grains like brown rice and oats, and fish like salmon. These foods naturally help boost your magnesium levels. If you find it hard to get enough magnesium from food, you can talk to your doctor about magnesium supplements. The typical dose is 200 to 400 milligrams per day, but your doctor can help determine the right amount for you. Another key point is to keep your blood sugar levels in control. High blood sugar makes your body lose magnesium faster, so it's essential to follow your diabetes management plan, which includes a healthy diet, regular exercise, and medication. If you're on medications like diuretics, they can also cause magnesium loss, so make sure to check with your doctor if you need extra magnesium or if an alternative medication might be better for maintaining your magnesium levels. Finally, regular checkups with your doctor are crucial. They can monitor your magnesium levels and adjust your diet or supplements if needed. 7. Zinc. Zinc deficiency can be noticed by several symptoms. One of the most common is slow healing of wounds, especially if you have cuts or foot ulcers, which take longer to heal due to a lack of zinc. Zinc is also crucial for a healthy immune system, so without it, you might experience more frequent infections. You may also lose your appetite or notice a change in your sense of taste. Zinc is important for hair health, so a deficiency could lead to hair thinning or hair loss. Skin problems like rashes or acne are also possible, as zinc helps maintain healthy skin. In addition, you may feel unusually tired or weak, since zinc is involved in energy production. Zinc deficiency can also affect your mood and cognitive function, leading to depression, irritability, or trouble concentrating. Finally, if you have neuropathy, zinc deficiency can make it worse, leading to tingling or numbness in your hands and feet. If you're experiencing any of these symptoms, it's important to speak with your doctor, who can test your zinc levels and help you address any deficiency. Zinc deficiency is common in diabetics, mainly because high blood sugar levels cause the body to lose more zinc through urine. Since your kidneys are working harder to get rid of excess glucose, they also flush out important minerals like zinc. Additionally, in insulin resistance, which is typical in type 2 diabetes, your body struggles to use zinc properly. Zinc is also essential for insulin production and helps regulate blood sugar, so a lack of it makes controlling glucose even harder. When you're deficient in zinc, it can make insulin resistance worse, leading to higher blood sugar levels. This means you may need more medication to manage your glucose levels. Zinc also supports your immune system, and without it, you're more vulnerable to infections, something diabetics already struggle with due to high blood sugar. Zinc also helps your body heal wounds. Since diabetics are prone to slow healing wounds and foot ulcers, a deficiency can make the healing process even slower. Finally, zinc acts as an antioxidant, protecting cells from damage. Without enough zinc, oxidative stress increases, which can lead to complications like heart disease and nerve damage. In short, zinc plays a vital role in regulating blood sugar, supporting the immune system, healing wounds, and reducing oxidative stress. If you're deficient in zinc, it can make managing your diabetes harder and lead to complications, so keeping your zinc levels in check is important. To overcome zinc deficiency as a diabetic, the first step is to eat foods that are rich in zinc. Good sources include meat, like beef, pork, and chicken, seafood, especially oysters, crab, and lobster, beans, nuts, seeds, whole grains, and dairy products. Adding these foods to your diet will help boost your zinc intake naturally. If you're having trouble getting enough zinc from food, you can also talk to your doctor about taking a zinc supplement. A typical dose is about 15 to 30 milligrams per day, but your doctor will help determine the right amount for you, as too much zinc can cause other issues. In addition to improving your diet, it's crucial to manage your blood sugar levels. High blood sugar can increase zinc loss, so keeping your glucose levels in control can help preserve your zinc levels. Following your diabetes management plan, including eating a balanced diet, staying active, and taking medications as prescribed, will help you maintain overall health and prevent zinc depletion. Lastly, regular checkups with your doctor can help monitor your zinc levels and catch any deficiencies early. By staying on top of your zinc intake and blood sugar management, you can avoid complications and better manage your diabetes.